All right, we'll give people just a moment to get settled and then we'll go ahead and begin. Well, hello and welcome to the inaugural Center for Health Technology and Innovation webinar series. We have an exciting lineup ahead, including sessions on AI and imaging. Today, though, we're offering a sneak peek at our Health Innovation Pavilion at Scientific Sessions, which happens on November 16th through the 18th at McCormick Place in Chicago. There we go. So I'm Pat Dunn from the Center for Health Tech and Innovation, and I'm joined by three special guests: Dr. Seth Martin, a cardiologist and professor of medicine at Johns Hopkins, and an innovator himself; Megan Antonelli, CEO of HealthIMPACT Live and the producer of our health tech competition; and Patricia Baran, Senior VP at AliveCor with over 25 years of health tech leadership experience. So here's the scoop. This is our 9th health tech event, hosted within AHA Scientific Sessions. Our health tech pavilion in the Science and Technology Hall will feature 115 speakers. Many are first-time speakers, and this also includes our health tech competition finalists. We'll kick things off with an opening session featuring leaders like Drs. Bob Harrington, Eric Peterson, Lee Schwam, along with industry experts from Cadence RPM and Motive Care. 5 finalists will compete in the health tech competition on Saturday and Sunday, evaluated by expert judges on how their solutions address business, science, and access challenges. The winner is presented by Star Jones, and the event is sponsored by the Laerdal Million Lives Fund. There'll be a main stage event held on Monday morning, which focuses on health technology's impact on cardiology over the last 100 years. Afterwards, swing by the Health Innovation Pavilion for demos from Innovator Network companies, moderated by AHA's incoming president, Dr. Stacy Rosen, and MedTech Innovators CEO, Paul Grand. We're going to be doing demos and innovation showcases throughout the weekend. My favorite actually is going to be a session with 5 students from the SINA Research Institute presenting their research really for the very first time at AHA. I want to highlight this year we're introducing new moderated roundtables following the panels and presentations to encourage more audience interaction and a deeper dive into the topics. Seth, Megan, and Patricia are going to share more about the robust programming in the pavilion. But as you can see, the educational program really offers something for everyone, from pediatrics to geriatrics, from students to deans, and from AI to community health. So without further ado, let's begin the program. And I'm going to go off share. All right. So I want to start with Seth. So you're a cardiologist. You're an innovator. You have participated in our event in previous years as a moderator, a presenter, a judge at the competition. Your whole team has become really, standard, parts of all of our programs, and you're an innovator yourself. So can you share a little bit more about the experience of the Health Innovation Pavilion for you?
Yeah, thanks, Pat. I mean, well, first of all, kudos to you for all the hard work you've done in putting this together, making it better and better every year. I think the programming has gotten better and better every year. I think you've gotten a better location every year for the Health Innovation Pavilion, and you've been very gracious in including me and members of my team in the Innovation Pavilion, like Nino Isakadze, Francoise Marvel, Aaron Mikos, Aaron Spalding, and so forth. So it's, for me, it's become a home base at Scientific Sessions. So Scientific Sessions is kind of this massive meeting with so much happening in parallel. But I really like coming back to the Innovation Pavilion as a home base to learn from colleagues around the country, all over the world. Such exciting discussions that are happening every year around digital health, wearables, AI, and so forth, and how we can improve the care of our patients. And I love the the interdisciplinary nature of the discussions, as well as the crosstalk between academia and industry, having the companies with each of their booths right there around the Innovation Pavilion, and just being able to have spontaneous conversations with the leadership of those companies, what they're doing, and how it can synergize with our research. It's So it's been a tremendous experience, and I just want to again thank you, Pat, for all you've done to make this Innovation Pavilion better and better every year.
Thanks, Seth. I really appreciate it. And obviously, thanks right back to you for not only you, but your whole team being such a prominent part of this. So, Megan, for the past 3 years, you, along with our colleague Jeff McCauca, have really produced and managed our Health Tech Pavilion. It's really become our signature event. It's become a can't miss event. It's literally standing room only. So, what do people need to know about the Health Tech competition?
Oh, well, I want to echo what Seth said, Pat. You've really done such an amazing job with it. And I've just been so impressed. I go to hundreds of events every year, and it's literally my favorite event to go to. And the Health Tech Pavilion is so impressive in that the clinicians and physicians that are there are so enthusiastic about the tech and just learning, and just, and I love the idea of it as a home base, because in that very large show with over 15,000 people, it's a great little area that we've got in that hall for everybody to come back to and learn about innovations. But the health tech competition has been, also my honor and pleasure to work on, because it's just so much fun, and it's great to see all of these innovations that come through. We get hundreds of applicants each year, and the application process is underway. The deadline to apply is this Friday, so please, calling all innovators, join and submit it, and then you get a chance to pitch your, both from a business side and a science side. So there's two pitches that happen, one on Saturday and one on Sunday, and judged by a really distinguished panel of judges that Pat, you showed, but Dr. Lee Schwam from Yale, Dr. Bob Harrington from Cornell, so many. And then of course this year we've got Lisa Sunin, who's just joined the AHA for the Ventures Group, and Jeff Trost, from Laird O'Malley Lives Fund. So we're very diverse and robust, not to leave out, of course, Star Jones, which is our star factor, if you will, that makes it super fun. And she's an amazing AHA volunteer, and it sort of always has great questions, and it just makes it lots of fun. So I think you said a lot of it there, but it's always a real highlight, and the winners will get announced, and of course Nancy Brown will be there to help us give them their awards on Sunday afternoon.
So, Megan, if you're an innovator, listening to this or watching this, and you're trying to decide, should I apply for this or not? So, what type of companies are we looking for to apply to the competition?
Yeah, I mean, it's a wide range of companies that apply. I would say, like, not your just idea stages. You want to have, be in practice, have some pilots going. It's not required that you have pilots going, but that I think has been beneficial to those who build out their presentations. The application process is actually quite easy. We keep it simple. And then, the pitch competition and kind of what you're able to show is somewhat standardized. And, I think it applies to most companies with good innovations, sort of in that mid stage.
Thank you. So, Patty, you've been a health tech leader yourself for 25 years. Really bringing health technology solutions to the market. You've been a healthcare professional yourself, starting your career as a nurse. AliveCor is a member of our Center for Health Tech and Innovation's Innovator Network. Dr. Dave Albert has really become one of the headliners of our event. So what has the experience of being part of this event been for you and for AliveCor?
Yeah, first and foremost, I'll just echo Pat, you and Jeff and the rest of the team just do a fantastic job. For AliveCor, this is one of our highlight conferences to always participate in, and we've been participating for years. Personally, how I see the conference is the pavilion, the Innovation Pavilion is really, no pun intended here, where the pulse is. It's the heartbeat of scientific session. Everybody wants to be there. And the beauty of why we love it so much is that you have these, thought leaders of the industry, the providers, the researchers, and the commercial side industry able to really get out of their normal routine and come together and collaborate, have hands-on, very direct conversations that really align to AliveCor's mission, which is all about increasing access and providing technology and a great experience and the use of AI to not only help the patient, but to also help the provider and the staff. And so we align to the AHA's innovation mission completely. As you mentioned, Dr. Dave Albert, our founder, who is also our CMO and still today, innovates every day. We will be showcasing this year our new 12L ECG device. And so that's taking the first of its type. We're taking standard 12-lead EKG, which is nothing new, right? It's been around for decades and decades and decades. But this is how collaboration together gets innovation and thoughts and ideas of what do we need to do to service our mutual patient together. And what we need to do is make things more accessible and easy to use. So this is the first of its kind, a handheld EKG, goes in the palm of your hand, one cable, 5 electrodes, but producing the exact same output of a full 12 lead. And so it's this ability to have these conversations in the Innovation Pavilion of leading thought leaders with the researchers. We're in, AliveCor's in over 200 published research articles, which we have presented to in the past. You've been nice enough to invite Dr. Ben Green from our team as well, who's participated and shown how using personal EKG devices with AI allows for quicker time to diagnosis, treatment, and reducing the total cost of care by reducing urgent care visits, ED visits. And so it's the team dynamic and that collaboration of why we are so honored to continue to participate.
I have to give you a call out, Patty. I don't know if you can see it with the
Yes,
camera,
I can. Thank you for showing it.
So I have one of your devices, and I'll just on a personal note. So I was having my, as you can imagine, I got all this tech around me. So a little bit over a year ago, I'm taking my blood pressure and my blood pressure device saying, hey, your heart rate's irregular. You should get this checked. And so the first thing I did is I reached for your device and it said I was in atrial fib. My Apple Watch confirmed that. And I was completely asymptomatic. So luckily a device, I know there's always the risk of a false positive, but quite honestly, in my case, it could have saved my life. It could have, maybe getting into a doctor, getting on treatment, hopefully maybe prevented a stroke down the road. So I'll also have to give a call out to Seth because his team has been very gracious. I've actually used the Corey Health app. It's really helped me, kind of manage and all of my numbers are looking good. So, this really is a team approach. So I want to thank you. So Seth, I want to take it back to, so AHA is really historically, it's a science meeting. It's not really a trade show. So, cardiologists and practitioners like you in the past typically go to the science meetings and you might stroll through the exhibit hall when you're kind of between sessions. So what has it been like for you and your team, and especially some of your early career colleagues who really had a chance to participate in our events? Can you just share a little bit more about what it's like being in more of a exhibit area versus a more of a traditional classroom setting?
Yeah, absolutely. And I mean, first of all, I would just encourage folks to visit the exhibit hall and just have a level of comfort with interaction with industry. I mean, that so much of what moves cardiology, what moves the world of medicine forward is industry academic collaborations. And so the exhibit hall is a great place for those conversations. It has a very, I like what the description, Patty, around it being like the innovation pavilion being a pulse of the meeting. I think the exhibit hall in general has a nice energy to it. There's a lot of kind of great, movement flowing through there with all the companies. There's booths anywhere from big, huge productions to small booths, and a lot to visit there. So, and it can just be a nice place to sit down with someone and have a conversation. So I really encourage folks to visit there. Pat, like the personal story you just shared, I mean, it's a great example of where new innovations coming from industry can be very helpful on the diagnostic side as well as on the management side. I love the fact that you used AliveCor and then you're using Corey on the management side of things. It speaks to, I mean, I'm hoping this at Scientific Sessions, we could maybe have some more discussions between the Corey team and AliveCor around some collaborations we could do together potentially in the future. I mean, that's what this meeting is all about. Bringing the face to face, it's important, and that's when collaborations that could truly change patient care, change people's lives can start. I'm very passionate about this world of innovation, digital health, the collaborations between academia and industry, because there's so much we know that helps people, but we've failed to implement really, really well in a reliable way, in an equitable way. And I think that that's where, although the late breaking clinical trial results, showing that a new innovative drug helps improve outcomes is critical to our world, there's steps beyond that we still need to figure out on the implementation side. And I think the exhibit hall and the innovation pavilion is a place where those critical conversations happen.
So Megan, you're very, savvy, experienced in the tech world. We know that AHA is not necessarily on the roadmap for a lot of technology companies. That we're kind of, in some ways, a little bit newer into this space. Although I will have to shout out, you may see in some of our messaging, this is AHA's 100th year. AHA was founded in 1924 in Chicago. That's one of the reasons why the meeting is in Chicago. And technology has been a big part of cardiology really since its inception. So, the main lobby of the American Heart Association has the medical office of one of the founders of the AHA, Dr. Paul Dudley White. And you can see in there, an old version of an EKG machine, an old mercury column, sphygmomanometer, even a scale that had the balance on either side. So tech is not new to the AHA, but the AHA is kind of new to the tech world. So Megan, can you speak to a little bit about what is the value of a tech company for actually coming to Scientific Sessions and being exposed to our event?
Yeah, absolutely. I mean, I think that's a really important point. There's a lot of digital health conferences out there. There's a lot of health tech conferences out there, of course. And the importance now, because tech is ubiquitous, right? It's not just the EHR, it's not just infrastructure, although that, of course, is, the foundations. The tech that physicians use and clinicians are using is the most important tech there is, ultimately. And that's, we want it to be in their hands, and that's where innovation happens. So I think so much around the technology that's, at the bedside has, been separate in that discussion. And now we're sort of integrating it and combining it. And it's not only just in the hospital, but it's going into the home. So it's how are we, kind of getting all, putting that all together. And I think that's what makes it unique and amazing. And, that's why I like it better than all the others.
Thanks, Megan. So Patty, you kind of alluded to this earlier, but what do you see as what is the value for a company for actually being connected to us, being connected not only to the AHA but to our center? How do you find value in that?
That's a great question. But Seth, for sure, I'll definitely meet with you so we can continue to have those conversations and collaborate for the future. Then we could be on a panel on the next year and talk about all the results we've driven from this one. But what's the value for us? I think it kind of, to summarize it, it's the proof. Humans don't like to change. Physicians don't like really change, and they're scientists at heart, and they need validation and proof, because at the end of the day, they want to improve their patients' care outcomes and experience. And so there is that time where you need that collaboration and validation, which is why AliveCor's technology is adopted so well and is the #1 recommended personal ECG device, FDA cleared, that physicians tell their patients, such as you, to go buy and monitor their care, is because there has been so much research proof that this is equal to or better than what it is currently today. Technology conferences that Megan mentioned before, yes, there's plenty of them. They're not looking at it through the lens of the scientist or the provider that is really taking that next level of validation on the clinical outcomes and the reduction or improvement in the care pathway. And so this is why I think the AHA Pavilion for Innovation is so critical, is because you have that critical lens, if you will, of the provider who owns that wonderful relationship of the patient aligning with the industry to say, let's do this together. And so as the scientists walk around and providers are looking for, hey, I need to research some other outcome, but I want to do this in a convenient way with a very proven, reliable technology and proven AI that delivers the highest sensitivity and specificity. They look for folks like AliveCor at these sessions to collaborate together. So it's a win-win-win for, and who brings us all together is the AHA in the Innovation Pavilion. So that's why the value is so incredible for us.
Thank you. Appreciate that. So this question is kind of for all three of you. I see yesterday that John Hopefield and Jeff Hinton won the Nobel Prize in Physics for a lot of their work in machine learning that has led to some amazing breakthroughs in AI. I know this is not all about AI, but AI is on the top of everybody's mind. What does the future look like in health tech for each of you?
You want me to go first?
Sure.
I'll jump in there.
Yeah.
So AI is not new to AliveCor. As you know, we've been around. Dr. Day found us back in 2011. So we have now over 250 million ECGs. We have 280 million ECGs. Why is that important? The amount of data to actually run and test and improve your large learning model on to make sure your AI you're delivering has that specificity and sensitivity and correlation at the highest level is what is critical. And so from an AliveCor perspective, we lead in that space, and we will continue to lead because the data is so important. But we also collaborate with our health systems, our leading health systems, our providers to make sure we continue to enhance that. And as more and more EKGs are coming in weekly, 1 million are coming in weekly now for us, it allows us to continue to add to that AI, so we get like new determinations approved by the FDA at this convenience level, this device that is a personal device that allows that patient wherever they are. And as care continues to go out of the hospital, in their home, in their community center, at their workplace, in senior living, wherever it is, whenever they're having that symptom, they know they get this result that the physician caring for them could be in another state, heck, could be in another country, is getting reliable data with proven AI to actually diagnose and treat. And so data is number one to prove the AI. AI is not here to replace. I think there is always that fine balance, right? Especially in healthcare, where we don't adopt quickly, number one. And we're not so trusting in the AI yet. But when you have a high sensitivity and specificity and correlation values, then of course it's adopted. So I believe you're going to see AI used more and more in healthcare, but to be accretive to the physician, nurse practitioner, all the other care team members, to just aid in their ability. Hey, their workload is tremendous, right? We know there's, I don't know how many counties in the US now that don't even have a cardiologist available to them. So we all need to embrace the technology that's out there and the AI to improve healthcare across the whole world, which is what aligns to AliveCor's mission.
Great.
Megan, did you want to go next, or you want me to jump in? Okay. Yeah, I mean, it's really exciting what's happening in AI. And we last year in the Health Innovation Pavilion, there were great conversations, and I think those conversations this year there's even more to discuss. I mean, we all have this sense that things are changing in a fast way and in a way that I don't know that anyone can fully comprehend. But I do believe AI is going to change every aspect of the patient journey and delivery of healthcare. Pat, you all in the CHTI created this really great figure that goes through the entire patient journey, from kind of wellness to initial diagnosis of a medical condition to acute care, post-acute care, chronic care. And I iterated on it a bit for this Centennial AHA circulation article that I'd published recently. So we'll probably get a chance in the Innovation Pavilion to share that figure. And I think we're going to be discussing kind of every aspect of the patient journey. Okay, yep, here it is. So this I guess this is the updated version. Awesome. So I mean, what AliveCor is doing in diagnosis of AFib is really powerful. And when it comes to kind of how busy we are as clinicians taking care of someone after they're diagnosed, AI, I hope, is going to make us more and more efficient and effective. And that efficiency will buy us back time that we can use for kind of high order thinking and spending time with our patients, the art of medicine. I hope it'll keep improving that time we have with patients. And it's going to improve the way we educate patients. It's going to improve the way that we titrate guideline-directed medical therapies. Every aspect of the patient journey and delivery of care is changing. So this is going to be a fun conversation to have, like, with such a diverse group of people in the Innovation Pavilion, just how the latest thinking that everyone has around AI, because it's evolving so fast.
You're actually moderating a session entitled AI Everywhere,
Yep.
and it'll include your colleague Nino Idzikadze, as
Yep.
well as Dr. Dave Mintu Tarakia and from iRhythm, and Jim Malt from BioIntelligence. So that should be really a can't miss panel.
Yeah, that's going to be a fun panel.
Yeah, I mean, and I'll only add, I think you both covered it really well, but I think, last year we started with, there was a discussion, and it's amazing how far we've come. And even though AI has been around a long time, I think it's the attitudes that are changing, and the discussion and the discourse and the comfort level. So we're seeing a lot of that. Of course, last year's winner was RCI Technologies of the competition, and they're an AI-based medical tech company for early heart attack detection too. So, I'm sure, we're seeing a lot of applicants come through with AI applications in their applications. So it'll be exciting to see what's new and on the horizon.
So as we conclude, and we'll start with Patty for this one, because Patty, I know you are based in Chicago. What are some
Yes.
things you're excited about with Chicago, both inside the pavilion and outside? I know the Bears are playing the Packers. They have a home game that Sunday, so it should be pretty crazy mix of football fans and cardiologists. But also, what if someone's new to Chicago, which do you have any recommendations, places to go, places to eat? We'll start with Patty, but I'm sure Megan and Seth has some recommendations as well.
Well, that is a loaded question. So first and foremost, I'd say what I'm looking forward to is the energy inside and out. And yes, that rivalry of the Bears and the Packers is going to be amazing to watch. Hopefully the weather here has been fantastic. So if it continues, I'd recommend people just get out and walk around, go down and walk by the lake. It's such a beautiful walk. It gives you, peace of mind, good for your heart. All of that is great. As far as recommendations, there's so many restaurants. It all depends. But of course, one I have to just always say, when in Chicago, make sure you try our pizza. I have my own. Gino's East is one of my favorites, but Giordano's or Lou Malnati's or any of them will work. So for sure, try that. But I don't think you can find a type of food or not find a type of food in the Chicago area. We have the diverse array of fabulous restaurants, but get out and explore the city. It's just I think fall is one of the best times. And with the 100-year celebration, I'm assuming there will be a lot of fun things. You should do a scavenger hunt of the 100 things to go find in the city, and then make people go out and actually do that journey. But I think that's it for Chicago. And thank you again, Pat, for allowing me to join your presentation today.
Thanks, and that was a great suggestion. We used to go to Gino's East when I was a little kid, so
Great.
that was
Good memories.
our go-to experience coming to Chicago.
Awesome.
Megan, what are you looking forward to with the trip to Chicago?
Well, I do love Chicago. I think it's one of the cities that really has just gotten better over the years, and the history and of course the food is amazing. I love the park there with that big silver orb thing. So we did a lot of walking last year, and as you said, the weather was great. So that, and of course the competition, which I didn't mention. I think we might have put it in the chat, but if you are interested in learning more and applying, go to www.healthtechcompetition.com, because that's where you can apply until Friday.
That's great. Yeah, and we all should be looking at the long range weather forecasts. It always is a risk coming to Chicago in November, but
Chicago knows how to
had
handle
good
it.
luck in the past. Yes. And Seth, we'll have you close it out. So what are you looking forward to in Chicago, both inside the pavilion and maybe outside the pavilion?
Yeah, I mean, inside the pavilion, if it's cold like it often is in Chicago, then I'm looking forward to being warm inside the pavilion and all that, because I have waited in some, like, for a taxi line outside there at that time of year, and it can be quite cold. But I'm hoping outside we'll actually get lucky with some bit of warmer nice fall weather. I love Millennium Park. Megan was bringing that up, and Patty, like the water, the lake is really close there. You can walk down. So I love going to the Bean in Millennium Park and just taking a jog around all of Millennium Park and down by the water. So definitely plan to do that. And there are a number of restaurants in that area that are convenient to go to. So I thought about staying in the hotel at the convention center, which is the most convenient thing to do, but I actually booked over by Millennium Park just because I like Millennium Park so much.
Yeah, it's always a risk with food in Chicago because they're not necessarily all on the AHA diet. But if you get a little bit of extra exercise and do some you know, you could make up for it later. So it's Chicago's a great city. It should be a great event. Thank all of you for your time today, and we're looking forward to seeing you in Chicago at our Health Innovation Pavilion event. Thank you.
Thank you.
Thank you,
Thanks,
Pat.
Pat. Thank you. All
right, I think we're done.
Great job, everybody.
Did it meet your needs, Pat?
I think so.
I
Absolutely.
think so.
Yeah.
Good.
So I think, I don't know, I think Josh may have left us, but I think it takes a couple of days, but they will post this on the AHA master brand. So the AHA's YouTube channel. So we'll send it out when it's out.
Perfect.
So great. Well, thank all of you. Appreciate it.
Nice to see you. Nice to meet you, Seth. We'll see you in just a few weeks.
Looking forward to it.
All
Yeah.
right.
All
Take
right.
care.
Thank you.
See everyone. Thanks. Bye.